So we're anxious to see what we did yesterday, because this is such a complex, confusing bill. We sometimes don't know where we are with it. So now we are live. And Senate Health and Welfare is back, and we're moving on to a proposal of amendment for H 121, which is currently on the calendar. And so we will have to present this probably before third reading on the floor. It's going to be fun. And so, John.
I'm not laughing at you. I'm
It's okay.
sorry.
No, that is funny because I don't know how it's gonna happen. But so why don't we move on to this? I know this is a lot of interest to a lot of people, and we do want to make sure we get it right around healthcare. So thank you for being here, and maybe you could put it up on the screen.
Yep, so it'll be just a second. I've just sent to Kiki, John Rayos, legislative counsel, so any delay is attributable to me, not Kiki, just sent it. But hopefully in a moment, we'll be able to see that.
Is that right?
Yes.
We'll be looking at.
I'll pull up the proposed. Awesome. Here we are.
All right.
Yeah.
So we have a few changes here. The first that you're going to see, your first instance of amendment here on page 1, line 4, we are making some updates to the definition of biometric data. You don't necessarily need to worry about this first piece on line 7. This is a technical change that's necessary because this previously said biometric data means personal data generated for technological processing, because personal data, anything that's publicly available is excluded from the definition of personal data to the extent that biometric data is the concept of publicly available wouldn't fit here. So this is a technical cleanup to make sure that we're capturing all kinds of biometric data, whether publicly available or not. So information generated from technological processing. And what we've done here is really the substantive changes at the bottom on lines 17 through 20. Previously, what you saw was a specific exclusion for those recordings, audio recordings, images, and data derived on that basis, except as used to identify a particular person. We have reversed that. We've gone to what is in the House bill and including here specifically called out as biometric data depictions, images, descriptions, or recordings, and data derived from that to the extent reasonably possible to identify the specific individual. So this is boosting out what constitutes biometric data. And again, just to reorient, that's a kind of sensitive data. So opt-in required for that kind of processing. And the genesis of this, and I think you heard some of this from the AG yesterday. It was yesterday, I can't say it was, maybe it wasn't yesterday. Related to Clearview and scraping the internet for particular pictures. This is the idea behind this kind of data. The second instance of amendment is a change to the definition of publicly available information. And this is again tied to boosting out that concept of biometric data. You could have biometric data that's out there that meets what you see in buckets 1 and 2 on lines 5 and 7 of page 2. So biometric data that a controller has a reasonable basis to believe they may be lawfully available. This carves out from publicly available information, which again is excluded from personal data, which is the regulated concept under this act. Any biometric data collected by a business about a consumer without that consumer's knowledge. So this is, again, kind of goes to the Clearview piece. Like if folks have taken a picture of someone, it may have been in a public setting, but they took it through a window and someone doesn't know that they had this available, trying to protect that kind of information.
Can I ask a question about that?
Yeah.
Wait, so I think I'm confused partly because this is all just in a.
Yeah.
So
Yep.
This makes it stronger, like a
That's-
stronger protection
That's correct.
from the use of biometric data. It's more strongly protecting biometric data.
That's correct. The way that it works is personal data does not include publicly available information. So the bigger your category of publicly available information, the smaller your category of personal data, which is what's protected under the Act. So this narrows, makes smaller the pool of publicly available information by saying you could have biometric data that's out there that meets our common concept of what publicly available is. And we don't want it to be deemed publicly available information under this act, because then it will be excluded from the protections. So that's how this works. This is a greater protection for biometric data. It is a shrinking of the pool of publicly available information and expansion of the pool of personal data. The third instance, this is a cleanup change. You may recall the first thing I said when I came in was not especially meaningful. I just pointed out there's some superfluous language that literally the first definition of the bill. We didn't need to call it abortion because it's not pulled into any other term. So this is just a cleanup change. No substantive effect from that change. It's just cleanliness, basically. The fourth instance of amendment is a change from your data level extension. So this is kind of the key one that we've been talking about. This is 2417 is your section that sets out exemptions. And if you guys need me to reference the underlying bill, I can pull that up to show you the pieces. I just happen to run to another committee, so I don't have that up right now, but I can explain what this is. You previously had a data level exemption for HIPAA that said protected health information that is processed by a covered entity or business associate in accordance with, or documents they produce for the purposes of complying with HIPAA. This proposal on line 17, this amendment, would strike that section and replace it with a entity level exemption, but of a kind that we discussed yesterday that's slightly narrower than what was first proposed. So what was we had first heard is just exempting covered entities or business associates wholesale. So if you had someone acting in a dual capacity, I think we heard the hypothetical about the medical center doing certain kinds of housing. If you just had a straight exemption for covered entities, conceivably they could share that housing data in ways that this act might prohibit. What this specific exemption does is a bit narrower than that. It says an institution in its capacity as a covered entity or business associate. So this is meant to get at someone operating in a dual capacity, but let's say that they're only exempt to the extent that they're operating as that HIPAA entity. That's the idea behind this. It does mean, and I tried to flag this yesterday, that there will be some analysis required by folks to discover, to know with certainty if they fit the exemption. And we heard yesterday that to the extent that there's uncertainty, it raises folks' anxiety, causes them to make changes, it incur compliance costs. I think the sense we got yesterday was that folks were amenable to this kind of change, which requires maybe a lighter kind of analysis that would be required at the data level extension to determine. Lots of excited people now.
But
So, honestly, now, might have to watch.
we're good.
Yeah,
I'm
too many
counting.
people in the room.
Who wants to count it?
You look like you were counting.
I was. I got to 18. That could be.
All right, that's better.
We're good. All right.
Can I, I'm sure, I pulled up the bill, so I can try to look at this in the context of the bill. Do you happen to know which page? Because you memorized the bill.
Oh gosh,
No pressure, though.
this will be around.
2417, it'll be around page 51.
This is extension, so we're on page 16 actually. Yep,
Oh, it's on page 16.
Okay,
because we're in the exemption section right now, which is beginning of the bill.
okay.
Oh, okay.
Does not apply to, okay.
Yep.
So it's replacing
The protected health information.
protected health.
So I can just read it out, but what was in the existing before this amendment, this chapter does not apply to protected health information that those covered entities or business associates process in accordance with HIPAA. And now we're replacing that to be an institution in its capacity as a covered entity or business associate.
So before it was a data level
That's correct.
exemption, and it was about what is the data that is exempt, and now it's about
Whether you're the kind of.
an entity, but an entity that's acting in a certain way. So
Exactly.
basically, a hospital acting as what we consider to be a hospital would be exempt, but a hospital acting as a landlord would not be exempt.
Right, that's the idea. I will say I don't think I've, in other states, the approach we've seen is just one or the other. It's data level or the straight entity level exemption. This is meant to be a narrower kind of the entity level exemption to get at the kinds of harms we talked about yesterday. It does require some analysis, but the understanding was that maybe this analysis is easier than the data by data analysis. Like, it's probably clear if someone is operating, if they're a hospital, and they're doing healthcare, if they're operating in that capacity, it's probably not a hard analysis to make. And then you may have borderline questions. I mean, it's hard to know exactly what those borderline cases would be, but that is the idea behind this, is to have, if you're moving in the direction of the entity level extension, which this is, to at least have some cabining of what that is meant to be.
Okay,
What happens to? So. Is there any need to reference HIPAA protection in this?
So not really, because covered entity and business associate are defined terms under HIPAA. And our definition section uses those HIPAA terms. So what this means is when they're acting as that HIPAA entity, if you start pulling in as under HIPAA, it's either superfluous, meaning we've already referenced here in these defined terms, or you're actually veering back into data level extension territory, basically.
Okay.
It does, and I will just say it again, and I know you guys have heard it, but it does require some analysis. And I think when I mentioned this yesterday, there is a similarity in which this veers back toward data level because people have to undertake an analysis of what they do. It's just hopeful that that's a simpler kind of analysis than, oh, what am I doing with this particular piece of data? They don't have to ask that. It's, what am I doing? Like, am I a hospital? If I'm operating as a hospital? Questions about.
I think that. Thank you, I think you're doing a great job of trying to flag it, but I am comfortable with this as the middle ground. Of, having it be potentially, hopefully easier for these entities without giving them a complete exemption, because I'm concerned about the complete exemption, so I like this. Middle
I have
ground.
2 questions, when does this section go into effect?
So this is tied to when the whole bill goes into effect. There's nothing special about this section.
24,
So this will be July 1st, 2025.
25,
25. So this is not something that's going into effect immediately.
that's.
As you can
okay.
imagine, next year is going to be just as much of a battle as this
Oh,
year
yeah,
has been.
so, but my other question then is, what, if anything, do we have in the reporting section on elucidating
Sure.
the data types?
So I can jump down if you want me to go to that now. So we'll go to the end of the
Here's
amendments.
what my concern, I like having the middle ground, I think it's important to be able to segregate out this type of data, but we didn't hear any good examples, except for the one brought up in our committee about the differential data types, so I'm trying to sort out. That's hard for example, for the AG to do, how can entities do that? So I want to make sure that there's some help in here for that.
You mean if you had retained the data level exemption or just continued to contemplate but accepted
Yeah.
this? So here's what we have in the 8th instance of amendment. This is the existing council that was drafted in economic development. We do have a piece here to task that council with engaging in research on data privacy and developing policy recommendations. And this is page 6, line 18. Engaging in research on data privacy, developing policy recommendations for improving data privacy, including, I'll jump past this piece to the relevant piece. Subdivision 3 on page 7, also line 3. Recommendations for narrowing the exemptions under the Vermont Data Privacy Act, including based on research on the effects on healthcare industry of the health-related data level exemptions under the Oregon Consumer Privacy Act. As noted, Oregon is taking a data level approach to this, and economic analysis of compliance costs for the healthcare industry. So I think those are the most responsive pieces to the concern that you're talking about. Trying to build out what are the impacts of modifying this exemption, what happens when you tweak this. Admittedly, and I should call it when they have to actually provide this report would be January 15th, 2025. So the idea would be tied to, this could be factored into decisions in next legislative session. And the committees of jurisdiction have been expanded at request to contemplate not only economic development, housing and general affairs, but also you guys, health and welfare, and judiciary. Both in the House and the Senate sides.
Then I'm, okay, this is helpful. We do want to have those recommendations, but then I'm looking at, the membership of
Yes.
the group that's working on this. And given that we're identifying healthcare so specifically, I'm trying to sort out. I know we put in AHS
There's the Commissioner of Health.
and the Commissioner of Health. Is there any requirement that this group reach out to interested parties? Because there's some very savvy lawyers working out there for different organizations that might be helpful.
So there is not specific guidance as to who to go to, but there is let me go up to this piece that's fairly uncabined. On page 7,
Mhm.
line 15, the advisory council has the authority to establish subcommittees to carry out the purposes of this research recommendation piece. So this could include all kinds of stakeholders, interested parties. This does not have to be limited to what is listed in this membership. The membership is the council, but there are rights to establish committees that could incorporate industry, consumers. But it's not built out what those subcommittees would be or mandated that they include particular kinds of folks.
Go ahead.
Can I ask a question? My brain's going down a real dystopic tunnel right now, because I'm thinking about, like, Amazon is now offering like healthcare. And Jeff Bezos runs after-school programs and like early education, pre-K program. Like, I'm seeing, it just scaring me when I'm talking about the data that's gonna be cross-pollinated and commingled and all those things. I mean, I think you gave a good example with the hospital, but this is like even worse, because this is a giant corporation that is now gonna have healthcare data that's exempt from the GAT. Yeah, so I'm trying to get at.
This is a good example because I'm not worried about the organizations in our state.
Right,
I'm worried about the organizations out of our state, and we talked about
But
that.
they're in our state.
Well, I know,
They're in
but
our
I mean,
state.
that are established out of our state, but are big megalopolis, but.
right, but their tentacles are here, and they probably will eventually be here in a visible way, so. What, can you talk to me about how?
So this really is the question of exemptions writ large, like it's the same conversation. I mean, I don't want to put a damper on the motivating ideas here, because those are the animating concerns for the bill as a whole. And it comes down to who is picked up, who isn't. The crafting that you guys have of this particular entity level exemption is meant to try to strike that balance so that you can protect folks who are generally just operating as healthcare, that they don't need to worry about this, they can just deal with HIPAA. Then if you have large industry doing other things, I mean, another thing to say to the Amazon point, and I don't know, but just based on what you described, to the extent that Amazon is operating exclusively as that kind of covered entity, they receive the exemption, and you could say, like, that makes sense, like they're treated under HIPAA in that context. The idea is that they are protected, they're applying privacy protections from HIPAA, that's the idea behind it. And we may start getting in the area of fraudulent or other kinds of behavior, like, oh, people are actually violating, they are operating in this capacity and they're violating this act. And so at that question, the point becomes, well, how can it be enforced? And so then you're talking about how strong can we make the protections? Do you want a private right of action that facilitates further enforcement of these pieces? But you can start getting far afield into just like protecting against every conceivable risk. And again, we talked about, trying to make decisions on the basis of the good faith actor. But I take your point. The bill is meant to be capacious in its definitions to capture kinds of future harm. But the exemptions, you are in this lane of having to strike a balance between, you need to let people, say you need, it's you guys' choice, but you're trying to let people operate in the ways that we deem important. and stopping them from jumping into another lane. And I think that what you have here is a balance of doing that. It is not as tight as the data level exemption, but if there is real concern that the compliance costs and additional procedures would really hinder Vermont healthcare industry, that's a absolutely fair decision to make to go toward what you've proposed here.
Okay, let's move through the rest of the proposed amendment. This is,
So I will jump back to, we're now at the fifth instance of amendment. This is on pages 2 and 3, so bottom of page 2, continuing on to page 3. This is a flow-through change from including that new entity level exemption. What you see at the top of page 3, and again, we're still in the exemption section, we're talking about the chapter does not apply to information that originates from, that is intermingled so as to be indistinguishable from, or that is treated in the same manner as information described in this previously referenced subdivision 2 through 7. 2 was your HIPAA data level exemption. Because this now references the entity, we don't need to pick up that particular piece. So the highlights are to 3 and 3. That's just flow through changes. I will call out one piece here that I did not want to change in the absence of greater testimony, and I don't think that you're harming yourself with leaving things in the fashion that I have them. The exemptions that we haven't talked about, 3 through 7, that are hinted at or that are talked about here in this intermingled section, are health-related pieces. Data level exemptions for health-related pieces. Conceivably, and I just don't know, these are picked up to an extent by including the entity level exemption and so they may to an extent be superfluous, but in the absence of knowing definitively that that's the case, it may be that non-covered entities, non-business associates process this information, and we want to maintain the data level exemptions for them. I preserved 3 through 7, and perhaps in the future, people will say, we no longer need 3 through 7 if you have the entity level exemption. And if that's the case, then it's no sweat off your back that they're included. They're just superfluous in that instance. So it's a conservative approach to not delete 3 through 7. It doesn't hurt you to keep 3 through 7 here. They were already in the bill. Does that make sense?
yep, let's leave it.
Yeah, I don't think that there's no harm in leaving these. It's just that it might be superfluous, basically. The 6th instance of amendment, this is your second big change. So the first was the extension that we talked about, and we're on page 3. Line 8, this is your private right of action. So this is a proposal to include a private right of action for particular purposes, and I will walk through how this works out. So we retain in section A the reference to section 2453, which is our consumer fraud statutes, and we say person who violates this chapter commits an unfair and deceptive act in violation of that section, and the AG shall have exclusive authority to enforce such violations except as provided in subsection C. So subsection C is going to be your targeted private right of action. And we'll come to that. The highlighting that you see in this subdivision B is in substance the same as the information that you've received related to AG enforcement, but cleaned up, reorganized a little bit to read in a neater manner, but I will just call this out. So what does the AG need to do? If the AG determines that a violation of this chapter, and they can enforce any provision of the chapter or rules under it, they're not going to be excluded from piece that relates to the private right of action. It's going to be concurrent jurisdiction for that piece, is the way to think about it. But for the AG, if they determine that a violation may be cured, so somebody can fix that, they can delete the information, they can stop transferring, they can stop selling, whatever it might be. The AG may, and this is discretionary, prior to initiating any action, issue a notice of violation extending the 60-day cure period to that business alleged to have violated the chapter. And then you don't see any highlighting before because on page 4, this has not changed. This sets out the factors for the AG to consider when determining whether or not to grant that cure period. The real meat of the change here is on line 15, subsection C. This is your private right of action. This is the exclusive private right of action. That there is no underlying private right of action used in the consumer fraud protection statutes. This is what consumers would look to if they're trying to enforce this particular bill. A consumer who is harmed by a violation of subdivision 2419B2, that is the section that prohibits controllers processing sensitive data without consent. There's also a piece about if it's a child, they have to obtain parental consent, but the concept there is it's a prohibition on processing sensitive data without consent. So if a consumer is harmed by a violation of that particular section, or section 2426, which is your consumer health data protection specific section, it's that short piece about confidentiality, but most importantly for you guys, the prohibition on geofencing is contained in that section. So we're talking about just two pieces here. The private right of action is available if a business harms a consumer by processing sensitive data without consent, or they violate consumer health data under 2426, meaning they do something like establish a geofence to track someone going to an abortion facility. Those would be the instances in which a private right of action is available. But it's even narrower than that. There are steps that have to be taken before the private right of action is available. So those are the harms captured. A consumer who's harmed by violations of those sections may bring an action in Superior Court against that business for the alleged violation if, the if is key, the consumer notifies the controller, processor, or consumer health data controller of the violation. So they have to provide notice of that violation, and the controller, processor, or consumer health data controller fails to cure the violation within 60 days following receipt of the notice of violation. So they can only, the private right of action is available for these kinds of harms, but it's only available once they've provided notice and that business has not cured the violation within 60 days. I will pause.
What does notice mean?
How long
How
is
do they do
notice?
that?
Good question.
So the consumer just needs to relay, I mean, it could be an email, it could be something quite simple, just needs to email the business and say, so I should pause a little bit. We haven't talked so much about exercise of rights. Under 2418, the section that establishes the consumer rights, there are obligations for the controller to fill out particular, that to provide certain mechanisms for enforcement of rights. And one thing that will happen is say, you or I will tell a business, stop selling my data. Whatever, stop selling my sensitive data. The controller has the ability to reject that request. And there's a whole process that you can, there's different time periods, and the controller can relay that they're not going to accept, and the consumer has the ability to appeal. They can say, no, you should actually be doing this, it's required under the act. And at the end of it, the business says, I'm still not going to do this. Like, I don't want to do this. At that point, the information they provide back to the consumer says, it provides notice of contacting the AG, and it tells them they have the ability to, reach out to the AG for enforcement on this piece because they believe that they have a certain right under this. So that's one mechanism they could do for this, is there are established mechanisms for communication with the business. However, I should be clear, there's nothing about the section that mandates that they have to use that mechanism. They just need to provide notice. This does not say what the kind of notice should be, if it needs to be in some particular form. We don't have a built-out form for that purpose. It would be easy for it to hinge on the existing mechanisms, but I do want to make clear, this isn't mandating that a consumer go back and forth for 150 days with the business, and then after that have 60 days to wait for it to be cured. It's saying if they've been harmed by it, they notify them, and they don't do it. Now, the business will have notice that they aren't doing it if they're having the back and forth. I would also say that. So if people are following the mechanism and the person is saying, you haven't done this, they would need to provide notice of the harm. That might not be something that's contained in their response to the controller. So they would need that to be the case, but there's nothing here that is saying the notice has to be a particular form.
Okay, is there anything in the recording process about this section?
Well, what we have is a piece that says to report on enhancing the private right of action, which is an amorphous concept, just enhancing the private right of action. We could build out that concept more, although we're admittedly kind of up against time soon.
Yeah, I think clarifying the PRA is important, because I'm thinking about the business that has to reply to an email and may get flood. Could see flood emails. Now I think about Vermont businesses, but so it could be disturbing. So if there were some language that clarified the process, I don't know how you limit, but
Right, clarifying some kind of specific notice for,
Yeah, notice. and
like, the form that this
response,
needs
so
to
the
follow.
response could become administratively burdensome, which we're trying to avoid for smaller businesses.
But we also don't wanna make it so hard for the consumer.
No, we don't want to, I make it
That's
hard,
the point.
no,
You
exactly,
want it
right now, it's,
easy for
yeah,
them.
you're right, you're exactly right. Senator Good.
Thank you. Can you explain a little bit how, what curing will look like in the event of like a geofence
Yeah.
violation?
So this is, I think there are, the way that I see this, because I had the exact same question, is there are things that are not curable, is the way that I would think about them. The harm is done, and someone's not repeated, like if you're coming to visit a center, it's not as if you're, I mean, I don't know, but in certain instances, you may not be visiting but once,
Right,
in which case,
I know.
they're like, well, we've done it, we're not gonna do it again, but there's nothing for them to not do because you're not going again.
Right, and curing a geofence too could be like, well, we moved it 2 feet, or like, it just seems like there's a lot of room for
Yep.
manipulation.
I think, and to this point, I mean, these are great questions because they raise the fleshing out of the PRA and like needing to know how these particular pieces would work, before implementation. So I mean, I think it's key to remind that this would be not in effect till 2025. If you are particularly concerned about just given time constraints and the ability to flesh out these things, one approach that I've heard tossed around is delaying the availability of the private right of action further than the effectiveness of the bill. So make it not till 2026. And then you have time to work out even more. Obviously, you have next year to work out these pieces. But assuming still can't resolve these, you
I
can.
am concerned about geofence.
Yeah, so is that something that the committee would like to consider, to put it, the date, the suggestion of the date, Senator,
I don't
you're first.
think so. I'm fine with it because I think that in the instance where there's no cure, in the geofence instance, somebody goes to a clinic, their data was stolen because somebody illegally geofenced it. There is no cure for that, and the courts would presumably weigh in and say there's no cure. And so they have the ability, they have the right to take action.
So that is my intuition as well, but what I will say is it would be fair for a business to look at this statute and wonder if that's the case, just because it says fails to cure, so they're of the opinion, I haven't failed to cure, it's just there is no cure, right? So I agree with you, I think that's the way that it would be read, but I think, I just take these points to be there needs to be more building out of the PRA, and we have time to do that, I mean, it doesn't, like you. it
Well, there's
doesn't go into
time,
effect
there's
immediately.
time to do it as the bill is currently written, and then there's also time to reconsider
Exactly,
David.
exactly,
When did the House version of the PRA go?
this would be 2025 for them, so.
And how did they define this?
This is, so they have. Essentially the same concept, it's not targeted to these particular sections, it was any violation of the chapter, the private right of action was available for any kind of violation, so this is a narrower kind of harm. But it had the same mechanism in place that they provide notice, there's a 60-day cure period, and only upon failure to cure can the consumer then bring suit.
I mean, could you put something in that if the controller fails to cure or if no cure is available or something like
Yep.
that?
You could absolutely include something like
That's
that.
good. That's good.
Procedure question, so if you extend it out to 2026, what mechanism would be used to make sure it gets taken out?
Well, that would be the,
It would be an effective date, we would just say not effect, this section goes into effect, I would have to separate it out because you would want the AG enforcement available immediately, so I might split this into two separate sections, so you have the AG enforcement at the start of the bill, and the private right of action, in a separate section that becomes effective 2026, but.
there's still time, I mean, right now, it doesn't go into effect until July
I'd
25.
Yeah,
So
I'd rather
think
not extend it out.
Let's just leave it, and then we'll leave it for now because we do have time next year before, and the report will be coming back from the AI group, this is called AI group. And so that will allow for continued consideration of this. So this is the big area. Let's leave it for now, and then we may come back decide has to be
I'm
changed.
sending that. But we'll add that if there's no cure.
Yeah, no, I
fails to
said
cure,
that.
Yeah,
We
okay.
said that. We agree with that. I just am
I just wanna
responding
make
to
sure John
Senator.
is good, has the clear direction.
I'm responding to Senator Williams' question about 26. There's still ample time for reconsideration or consideration. And then we've added in the cure language to that. So can you read what we have added?
Yeah, so consumer harmed by these sections may bring an action if the consumer notifies of the violation and the controller, processor, or consumer health data controller fails to cure the violation within 60 days following receipt of the notice of violation, and we would have, or if no cure is available.
Yeah.
So it would be notice plus no cure. In any instance, notice has to be provided to the business. But it could be notice plus there is no cure or notice plus 60 days to cure.
Okay.
So what can the consumer seek? And this is consistent with what was in the House version. Consumer bringing an action under this subsection may seek the greater of 1,000 or actual damages, injunctive relief, punitive injunctive relief, so stopping the actions, punitive damages in the case of an intentional violation, so treble damages, enhanced damages for intentional kinds of violations, or reasonable costs and attorney's fees. These would all be available. I'm realizing now I may not have the edited version. There's a slight tweak to just how this was worded, same substance, but to make clear that all of these would be available because there could be some confusion. Any or all. And the last piece here on line 6, subdivision 3, notwithstanding subsection 2461B of this title, that's your consumer fraud underlying private right of action. The private right of action available to consumer for violations of this chapter or rules adopted shall be exclusively as provided under this subsection. So this is making clear only private right of action under the Vermont Data Privacy Act as drafted here is what's contained in this section. You don't need to look to 2461B and therefore have duplicative private right of actions, and potentially that private right of action could be available the entirety of the bill. And just to make clear that that's not what's happening. This is the PRA.
Staying in our lane.
Mhm.
Staying in our lane.
I mean, and just to call out the tie to 2419B2, sensitive data has a lot of health data components to it. That's why you guys are focusing on this section. It does contain more than just that. But the processing of sensitive data is a huge piece. Consumer health data falls into that and is a big bucket there. The 7th instance of amendment, this is the bottom of page 5. This is the geofencing prohibition. So we're talking about in section 2426, we say that no person shall, and this is for, they have to meet the applicability requirements of the act. So that's conducting a business in Vermont or targeting products or services to Vermonters. Those persons shall not use a geofence to establish a virtual boundary that is within 1,850 feet of any healthcare facility, cleanup change, including any mental health facility or reproductive or sexual health facility. Piece that you don't see here is the real substantive change that happened here, which is removing the piece saying for purposes of identifying, collecting, tracking, and the like. I know that there was back and forth on this. I think this is where you ended up. I had noted to me there's some comfort in calling out the purposes because you make clear what kinds of harms you're trying to get at, and we don't have to take a position on unknown permissible uses of geofencing, but given that none of us could figure out if there are permissible uses of geofencing, I think that was the basis on which you guys settled on this. But did just want to raise that that's how we arrived at that deletion.
I thought of a question I'll ask later. So it's related, but I don't want to bring up.
Worms. I don't know.
So the 8th instance of amendment, we've kind of already talked about this. This is the modifications to the AI and Data Privacy Advisory Council. We walked through at the bottom of that page on line 18, tasking with engaging in research on data privacy and developing policy recommendations. That includes development of education and outreach to consumers and businesses, recommendations for enhancing the private right of action, and what we talked about in most detail, recommendations for narrowing the exemptions based on research on those effects of a data local exemption in Oregon and economic analysis of compliance costs. And then we called out that we have an expanded set of committees of jurisdiction to which a report would go by January 15th, 2025. On page 8, we have added a member to this council. This is line 15. That the Secretary of the Agency of Human Services or designee would take part in this council. I will call out, you do see that the Commissioner of Health is already, or designee is already a member of this council, so there are some health representatives here. And the last thing that you see on page 9, this is a flow-through change, just to make clear that those members who could not have been appointed by August 1st, 2022, as is set up in the underlying existing law, have to be appointed by August 1st, 2024. That is the entirety of the proposed amendment. I know there's at least one change proposed here to the priority of action to add if no cure is available. I wasn't sure if we had settled on others, and I'm happy to answer other questions that you guys have.
Okay, so having experience with artificial intelligence, which is the last
Yes,
qualification piece, so.
not mandatory, and I
Define that. I was trying to figure out what that means, because artificial intelligence to me means sort of developing software and other things that, or does it mean that you just know what it is? I'm trying to sort that out.
So it is, to your point, it is generic, and I think that is a conceivable interpretation of it. I think it's also fair to respond to what I think the premise of this question is, which is, what does artificial intelligence have to do with data privacy?
I'm with you on that.
And the answer is, I don't know what it does.
I don't think artificial intelligence is really the key knowledge base that you need in order to do this work. So for me, well, how much trouble do we get into by striking that?
This,
How about?
so I don't think, I think the choice here, and obviously you guys can choose to do as you please. The choice to me would be whether you accept the concept of an expanded AI council that includes data privacy or not. That's the real question, because you don't want to strike this qualifications piece, because it is an AI council. That's what it's set up to do. This is a non-bifurcated, meaning that this expansion does not mean you're going to have a committee that splits into two sets of groups. This is the folks that are appointed here, including Human Services. They're going to now have a say on AI policy recommendations in the state. So, odd consequence. Maybe I should stop talking, but you know that's.
We understand. I mean, I've never liked the AI council being the group doing this, period. So.
I think the difficulty that you have is if you reject the concept, the way to deal with the rejection is to delete this section wholesale, and then you're left without any kind of education and outreach development coming back with particular reports on things, and given time constraints, I don't know that we can slot something in easily. So I feel that you're sort of unfortunately stuck in a way. But you guys can choose to do what you want. It just may be that this needs to be handled elsewhere and we're running out of time.
Yeah. Senator.
So, ounce of prevention worth chronic cure, so. If we may, I wanna go back to the opt-in, opt-out. I mean, if people don't, a lot of people don't know that they're, given permission for people to use their data. And I'm talking about the consumer.
Yes,
So are we sure that we have enough language in there
I think so. And I will pause my share and pull up the specific language, because what's key here is the definition of consent. This is a yes, you can see up on the screen.
Yep.
And I will call the page number. This is page 3 of what you received from Economic Development. It's a clear affirmative act signifying and here's the key part, freely given we can assume that specific, meaning it is for the particular purpose. Do I need to pause?
I just wonder if we can, are we gonna vote this today?
Well, we'll look at it and then I think we have a couple of changes that we'll make. We'll look at a clean copy and then we can go in a corner somewhere and vote on it.
Okay.
It's
I
before
definitely
third
wanna see
reading.
it before we
It's
vote on it.
right, so it's before third reading, so it's not before second reading, which is today.
Okay,
And we'll take some time to talk with economic development. So you're okay.
okay.
You are excused.
Don't let them vote us.
So specific, meaning it has to be for that purpose. It can't just be a blanket list of things, and you'll see that. We'll come to that later, but informed. So this is a key concept too. They need to know what they're actually consenting to. I think we had the hypothetical of the 14-year-old using the period tracking.
Right.
This specific, so they know what they're consenting to, and information to let them know, like, what is the actual content of what they're consenting to, not just you checked a box. You know, it's meant to be more fulsome than that. An unambiguous agreement to allow that processing does not include, and this is exactly to the point as well, acceptance of a general or broad terms of use. They can't just have this big document. And they're like, what am I consenting to? I don't see. It's got to be specific to that thing. Can't be just be a broad terms of use. Companies aren't permitted to hide their information to get you to basically deceptively get you to consent. It needs to be informed, freely given, specific. And they can't just close out a piece of content, X something out. They have to actually take a step to do it. And this prohibition against dark patterns is truly malicious, deceptive ways of obtaining consent. That's very good as well.
We're almost done. Okay, you run. And should this go into effect the way it is, won't be any requirement that an organization go back and get this information new if they're already doing this.
So I think the specific piece that is an interesting question. If
Well,
you would
because
read consent.
I know for putting clinical data into our clinical database, there's already an opt-out.
So I
And
think,
and it's already a form that's been discussed and used.
right, I will just flag broadly, I realize we're talking about a specific concern. The act as a
Yeah.
whole is structured as an opt-out regime. Businesses operate as they are. So we're talking about a specific set of things where opt-in is even the principle that's in place. Just want to remind you that that is just a piece of the whole bill. It's not the whole thing. So I think that the specific requirement that you have to specifically consent could be argued to require reconsent each time, but that is
I'd
it's a
rather
good
not
question.
have that. I think that's another battle we don't need to fight. We've already
Right.
been through that about 20 times. Yeah. If there's some language that could be added into the healthcare section that says or references healthcare, that to me is really important.
So, sorry, just explaining like a situation where you would want to, like, what is it that you're trying to avoid?
Well, right now, clinical data is put into the vital records, which is then shared
Yes,
across.
yes.
Yeah,
Yeah, so I think you're fine. The privacy notice that goes out contains disclosed purposes. We have our data minimization principle, which states that you can only process information as reasonably necessary and proportionate to those purposes disclosed in the privacy notice. So they tell you we're going to do this. For consumer
It's
health data, we're
pretty-
talking about consent in
yeah,
Um,
very clear.
I think what we're talking about, you're safe, that you have consented to it, but it is, I can think more about it, we are running out of time. Yeah, let me think about that.
Think about
Talk
that,
to-
because we don't want, and it doesn't go into effect in 2025, but we want to be clear. And I will say, shining a light on this could cause a whole nother episode of debate, and we need to avoid that because we put closure on this about a couple of sessions ago, actually pre-COVID. We don't want to raise those issues again. It's resolved. It was fun.
Yeah.
Okay, so we are at a place now, I think, where we could look at a new draft, clean draft. And, I'm sure we'll hear from people about it, but I think we've gotten to I think it's a good place. Now, so we can,
When do you guys, want to?
Yes.
I mean, I can come back, yeah, I can come back
well,
at some point later.
tomorrow, you're going to have to, I
Okay.
think, we'll have limited time tomorrow. But if we could look at this, and if we can have the draft today.
Sure.
just ASAP today, then we may be able to get together and agree that this is what we want to present to economic development, because we have that next stage. I want them to look at it before it's presented on the floor. So if we have it in our hands, the committee can look at it and then agree who's gonna be on it. But right now, I'm the one who's doing it, but the other committee members may want to be on it. So that's where we are. So the sooner the better.
Okay. Sounds good to me.
Okay. I know this is a really complicated area and it's so uncomfortable for everybody. I want people in the room to know the discomfort level that you feel is felt here around the table. And we want to avoid the problems that you think you're facing. And so do the best we can. I do know my question that I was going to ask was what happens to people who are visiting homes who may be exposed to medical information, but are not part of a HIPAA event. So I'm thinking about the AAAs. Mary Hayden just brought that to my attention. Thinking about AAAs who are delivering food. I'm thinking about, also think about VNAs, and there might be volunteers going in to provide, or choices for care, where you're going to sweep somebody's floor and you get medical information. And how do we deal with all of that? I mean, this is like a new world, and we don't want people to be identified for any kind of disclosure if they shouldn't be. I don't know, if you can answer that question. Those questions. That's one question.
The sweeper,
Yeah.
yeah,
I know. So where do we put that into the report back?
I mean, at some point, I think we would need to figure out what are reasonable harms to be like, to me, obviously, if that's the particular concern of the sweeper, that's something I think of that as you'll have these edge cases that, given time constraints, I think are not necessarily the best way to focus attention on resolving, but if they draw attention to just how to deal with, the point about the AAAs and like, that makes sense to me to focus on that particular piece. So I'm
Yeah.
sorry that I didn't respond to that. I'm focused on the sweeper. That piece is something worth thinking about, and I think if you're not meeting that, just to call out, if you are not meeting that HIPAA exemption, the steel level exemption, you are subject to the act. So my understanding is those folks aren't fitting into A2, 2417 A2, and therefore would have to comply with the Data Privacy Act.
And that begins in 25. And do we
Yes.
have anything in the AI committee that is going to, well, AHS is in there, but can we identify that as an issue somewhere?
Okay, yeah.
That's all I'm saying.
Add to the report.
Yeah, that's gotta be added into the report, because I'm scared about that.
15.
And I know about people going and delivering and helping, and
And just,
they're volunteers,
Mhm.
they're good Samaritans. I'm sorry.
so just because I'm not familiar with all the terms used in this committee, is there a category of entity that you would call those folks?
Social certificate, Mary,
Maybe community-based organizations.
Yeah.
That's what we proposed in our amendment.
yeah,
Thank you.
And I named some of the more generic types of services that fit under there. They're non-HIPAA, they're social services essentially.
Okay, that is helpful. I will follow.
Also, the volunteers needs to be brought into
the volunteer piece is
if
really.
possible, not just narrow to healthcare volunteers, but could it be more
For the
broad
record.
to volunteers? Including our volunteers.
Oh, for the record, Mary, introduce yourself. please.
Sorry, Mary Hayden from the Vermont Association of Area Agencies on Aging. I apologize.
Malcolm?
Thank you.
Okay.
We have limited time, and yes, right now we have limited time, but we do understand the issues around your organization, so we want to do what we can to clarify and simplify.